Now, evidence-based public health is different from evidence-based medicine. The difference also lies in primarily how these two disciplines are basically structured. For public health, our interest is in populations or communities. Medicine is about caring for a particular patient. So it is an individual patient in medicine, and then in public health, it is about a community. It's about a population. And that therefore means that when applying evidence, this application will definitely be different. Okay, so for medicine, the emphasis is basically on this patient, what should be done, what is the available evidence for me to care properly for this patient. So they look at the evidence that comes from clinical trials, and then they look at the patient characteristics and the clinical settings to make that decision. Now, for public health, we do not often carry out these randomized control trials. We cannot, because we don't have the resources. It is not feasible. It is unethical sometimes, many factors. So instead of carrying out randomized control trials, we carry out what we call quasi-experimental, or basically what we term as community trials or field trials, or sometimes we call them natural experiments. These usually are the ones that will commonly be done in the setting of public health because they are population-based. And public health as a discipline also relies on other disciplines. And therefore, the challenge with public health, the use of evidence-based in public health is that because you have people who come into public health with diverse backgrounds, because public health requires all these different disciplines to come in. So they come with different backgrounds. And therefore, making sure that we have standardization in how evidence-based approaches have to be enforced in the arena of public health becomes a challenge. Okay, so the second challenge, apart from that, is that, okay, if we are going to look at interventions, which are often community interventions, or you can basically term them as population interventions, usually one is that sometimes the results are not immediate, and sometimes the result cannot actually be, you cannot trace the results immediately. It will take you time to say, okay, there is improvement here. Okay, and this improvement is as a result of this intervention. So, evidence-based practice in public health as a discipline is quite challenging because of those the lack of standardization, because people are coming from different fields, so they come into that field with different levels of competence in research and evidence-based. And then also the interventions that can be compared, can be studied, we have variations, and especially one of the problems is that the results of these interventions cannot always be obtained immediately. But generally, evidence-based public health uses the best evidence that is available, okay, whether qualitative or quantitative. And if you have peer-reviewed evidence, that's the best. Okay. Of course, if you don't have good information systems, you are not going to succeed in implementing evidence-based public health. So, if you don't have good data, you don't have good evidence. If you don't have a culture for conducting research and making sure that you have systems for dissemination and rewarding people who are doing research, you'll have problems. Okay, and then the evidence is mainly applied in designing and planning for public health interventions. Of course, this is usually at community level, and these interventions, they have to take into considerations the behavioral concepts related to interventions. That's why behavioral sciences are very important in public health. Okay, the circle, how things are done is basically, you can say, we are using what we term as the public health cycle or approach, where everything that you have to do, you need to start with assessment, assess, and then decide on what needs to be done, and then evaluate and see if it is working or not, and then you can change a few things, and then the cycle goes on repeatedly. So it's about assessing, make a decision, assess, make a decision, and see if things are moving in the right way. And if things are moving in the right way, then you share, you disseminate. So you have interventions, even by the NGOs that we have in the country. Some of them are succeeding in some interventions, others, it is a waste of money. But do we have where we can always get that information on what has worked and what has not worked, or we also go blindly? So if we don't disseminate results of our interventions, our evidence, it becomes very difficult to see if we are making any progress. Okay, we already noted where that evidence comes from, so I will not emphasize that. Information system is very important for evidence about emergence of public health problems. Okay, evaluations become very important, and this has to be accompanied with dissemination. If you carry out an intervention, you have a very good framework for monitoring and evaluation. And then at the end, you are able to see if you have succeeded or not, and what are the grounds on which you basically succeeded or basically failed. And feel free to disseminate this information, because that is the point for learning. Okay, so dissemination becomes very important. Where do you disseminate? Journals, dashboards of, let us say, NGO forum. Sometimes some of the things are found on the websites of these different organizations. That some of that information that you find may not basically shed a picture on whether there was value for money. You go to websites of different NGOs and you see that they have reports, or financial reports and things like that. Of course, if you don't have a narrative reports or narrations to the reports, you as an outsider, you never know whether you had whether there was value for money or not. So always that is the challenge that we have. For any intervention that we always think about with the mindset of evidence at the back of your mind, you always ask, how big is the problem? We often say, what is the burden of the problem? What can work? What interventions are there? Can they work? Can they be applied to the local context? And then you ask yourself issues to do with money. Do you have value for money? Cost effectiveness? And then will people all be accessed, or will they benefit, or will have people that may not benefit from the intervention? So those are things that you really need to answer. The number of tools that you can use, some of them I've talked about them in relation to, for example, public health surveillance. These health information systems become very important, and issues to do with public health informatics, very important. Systematic reviews, you need to have, for example, your organization or even the government department that you're working for. What subscriptions do they have to these journals where you can access these research articles and see systematic reviews and things like that? And then the evaluations. What do they reveal, and what are the lessons that can be learned? Assessing how big the problem is, or how the impact of a health intervention, health impact assessments actually can be conducted. Participatory approaches can actually be used if you are going to engage different stakeholders and community members. So generally, evidence-based public health is very vital, because interventions that we have to carry out will need to be contextualized. If we have evidence that these interventions work somewhere else, can we contextualize these interventions and see whether they work? Okay, that's one major point. But of course, application of this evidence will have to take into consideration the fact that these interventions require collaboration among different disciplines, epidemiologists, biostatisticians, behavioral scientists, policymakers, and all the things. These are still very vital. So that marks the end